All right. And we are live. Hello, everyone. Thank you so much for joining us for another one of our live Q&As with Dr. Dawn Kennedy. My name is Sarah, and I'm a team member here with Neuropathy Treatment Group and Nerve Renew. If you haven't joined one of our lives before, we try to come to you every month with some valuable content, whether it be a resource or, in this case tonight, Dawn's really diving into a really important topic, and that is pain. So before we get into the meat of that, just if you haven't joined a live before, we love for these to be interactive and to hear from you as we're going through this. So as we're going through the material, if you have questions or comments or something doesn't quite make sense to you, we'd love for you to drop it in that chat box. So it's either going to be below the video here to the side, depending on what device you're on, but we'd love for you to just type those comments right in. And then we will hopefully be able to get to as many of those questions live tonight as we can. But if we don't get to your question, have faith. We will get back to you. Our customer service team will go through and make sure everybody's questions get answered over the next few days. So, Dawn, do you just take a quick moment, introduce yourself if we have anybody new joining us tonight?
Okay, hey everybody, my name is Dr. Dawn Kennedy. It's fun because we've been doing these a while and we've learned a few lessons. And lessons, for instance, I get about 40 years of practice, and that is that a lot of people still don't understand how things work. And one of the things I've done, and I've, as a family doc for that period of time, taking care of geriatric patients and seeing lots of neuropathy and all the interactions of the other diseases, is that people want to know more. I never assume that they know it all. And I never try to assume, and we never try to assume, that they don't know the basics. So tonight, I'm going to talk about some basics, and hopefully you can take notes tonight. That's fine, but we have this. You can watch it again, and they'll have notes on it. So just enjoy yourself, and let's learn a little bit.
Absolutely. And Dawn, that is exactly the role that you've played for us. We have just learned so much from you. You've been alongside us for years now. Just really helping us know the most that we can about nerve damage and neuropathy and what those resources should be. What is that basic understanding? What are those questions that patients are asking, and how can we help educate and teach? So thank you for all of your support to us, and then now being able to take all of your expertise and share it with our greater community and our customers. So I'm excited to dive in. As John said, this video will live on our sites, so you can always check back and rewatch anything. And then always, like we've said, throw questions in the comment box. Stay engaged on our pages. Our customer service team stays on top of that. So if you don't get or if you have more questions, don't hesitate to reach out. All right, with no further ado, let's get into tonight's topic, and it is pain. So we're specifically talking about pain, how it shows up in the body, how our bodies interpret it, what the heck, how do those signals come across, and then specifically neuropathy pain, and then what we can do about it. So, John, you were going to take us away with a little introduction?
Well, that's exactly right. So, but there's a lot of misinformation, a lot of misunderstanding. So, and I'm always doing this. Look, simplicity is the absolute must in understanding this. And you'll find that when I try to talk, not trying to talk over anybody. I want to make sure that you understand and picture what it is we're doing. And one of the best ways, and in medical school, we always did case presentations. That's how you learn through the lives of other people. And that's how we've done all of our lives. We learn by watching other people. And when we do doctor stuff, it's case presentations. And then we talk about it. And we did that in hospitals, medical school. So tonight is a little bit of a simple case presentation. And so this is so that you can picture yourself and or the other person whose name happens to be Ted. So let's pretend that Ted is a patient that came into my office. In this case, maybe your office, because you have to be somewhat of a doctor tonight. And Ted has a very simple complaint. Besides, he has some tingling and numbness in his feet. He is diabetic, and but he's having some increasing pain in his feet, and the increasing pain keeps him up. It affects his lifestyle. It keeps him from walking long distances. It keeps him from exercising, which is what you need as you get a little older. I'm not going to tell you Ted's age because I'm getting older and I don't want to tell anybody my age. So there. The, the fact is, Ted has a problem, and we're going to magnify that problem and look into it together tonight because Ted says, what am I going to do about this increasing pain? But let me give you some facts first. These are just facts you need to know about pain because it's pretty common. So, simple facts. 50 million people in the United States suffer from chronic pain. Now, wait a minute. What do you mean by chronic pain? Chronic pain, no matter what type it is a pain that lasts consistently for more than 6 months. I don't know who thought that up. 6 months seems to be a good number. So we'll leave it at 6 months. Poor Ted's been doing it 9, 10 months, but I think maybe it's been coming on a lot longer, but it's really starting to bother him. What's the number one reason that people come to the doctor and the emergency room? Pain. It doesn't have to be just neuropathic pain, any type of pain. When you're hurting, you're going to try to go see somebody. Yeah, we're focusing on neuropathy tonight, but remember there's other parts there's other things that people have, but remember this, number one cause of people going to the doctor and going to the emergency room is pain. But there's a more important issue. It's called disability. The inability to function in normal life, the inability to get where you want to go, the inability to learn and enjoy every single day. That's disability. And that is pain in terms of quality of life. Pain is the number one cause of what we call a disability. And I don't mean something you can see. I'm talking about your inability to function in life when you really want to do something else. And so I've spent my career, and I know the folks we're working with here have a really significant focus, because I know them, on living well. And so we really want you guys to live well. So pain isn't our friend, and we're going to do what we can to teach you enough to do something about it tonight. So anyway, Ted's one of those 50 million people who's had pain for over 6 months. Well, wait a minute. What's the cause of pain and neuropathy? First question. Any guesses? Oh, hi, Sarah. Would you like to guess what causes pain and neuropathy?
What causes pain and neuropathy?
It's a loaded question.
That is a loaded question.
Okay, so yeah.
It's something with the transmission, right? It's the way that the brain is interpreting the neuropathy, right?
Yeah. So did you see my picture?
Oh, that's right. Okay, no, I haven't. Let's see your picture.
I now have this thing, which may or may not work right, but this is my picture of a nerve, everybody. I drew it myself and not my grandchildren, but I want you to watch this. What you see are two neurons attached together going upward. What you see is black on the outside. That is what's called the myelin sheath. That's what protects every single nerve in your body. Now, the red in the middle are axons. They're just like the wires in your house. They transmit the signals to and from the brain, but in this case, we're talking about signals of pain. And you say, well, normally when this is working, you don't have pain. Its job is to tell you what's going on in the outside world. That's what nerves do. You step on a nail, you stepped on something. But if you're diabetic, and Ted's not quite there yet, and he steps on a nail, he'll still feel it. At least I think he will. Here nor there, the idea of a nerve working well is the axon is covered by the myelin sheath and all is well. A wonderful package of life. But what causes the pain and neuropathy, here's my picture again, is that black area around the nerve breaking down, that myelin sheath. Anything attacking it, from autoimmune diseases to high blood sugars to low blood flow, anything attacking that sheath will get to that neuron, that wire in the middle, and start sparks. And what will happen is you will not be able to understand what's going on in the outside world, because these axons in the center no longer transmit normally. They just start firing away, and with time they die, and that's what causes numbness. But in this case, the pain is a symptom that something is wrong, and these nerves are sending you signals that they are damaged. That's the big deal. Pain in neuropathy is caused by damage to your nerves in some way. Hey, Sarah, that's my big statement there. So
Yeah.
no round of applause, but it's okay. The idea of that is that if you get that one point, damage of the nerves sends pain signals to your brain. But there's another part to this. Now watch. This is important. If you look at my little picture here, I hope you can see it. There's an X near the top of that leading up to the brain. Okay? What happens, and I want you to understand how pain medications work, and I'm not going to name pain medications, but there are numerous that we use, and you got to live life. But if you look at that X, understand this second big point. The second big point is the only way you know that pain is there is that your brain interprets it, that the signal gets through that nerve and gets to the brain. But if you take medications block that nerve signal to the brain, which is great if you want to be out of pain, but not great if you want to heal your nerves, because you're hiding the very issue, which is nerve damage. Repeating that, nerve damage causes pain that is interpreted by the brain. Hey, did you hear that rhyme, Sarah? Okay, thank you. Anyway, the important thing is pain medications are good in terms of just trying to give you some relief, but they're not good for healing nerves. So the causes of pain and neuropathy are damage. Okay, what kind of damage? Well, let's just make it simple. Trauma, anytime, which is actually one of the number one causes besides diabetes, trauma to the nerves. What happens in diabetes is they have things called free radicals, which I'm not going to go into. I've been through the previous, but they're like fires all around that myelin sheath. Remember the myelin sheath on there? Fires, just burning holes through that sheath and causing that axon to start firing. And the other thing I think is pretty significant is vascular disease, low blood flow from high cholesterol, lack of nitric oxide, which I can go in, which we've been into before, but things that stop the blood flow from getting and clogging those arteries or causing spasm or inflammation in those arteries. So those are the big deals: diabetes, vascular disease, direct trauma, and there's a lot of other things. Anything that will affect that sheath will cause pain and neuropathy. And now you got to stop here a second and say, what the heck happened to Ted? Wait a minute. Ted comes in and his story gets a little bit fun. Not fun, funnier, because he tells me he doesn't know why. And I could tell you why, because I'm looking at his labs and saying your sugars are a little out of control, bud, and realize this damage has been coming on for 20 years. So we sit, Ted and I, or you and Ted, and we decide that what we're going to do is attack the diabetes. But there's some other things that you need to know about pain, besides the fact that pain is a signal that something's wrong on the outside. I want to kind of go through how I think about this, how I'm telling Ted. And hey, Ted, I want to show you this other picture. It's really, really artful, and I'm proud of it. Not really, but there is Ted. Okay. Ted is a little bit heavy, and he's diabetic. And if you see, there are three areas I'm pointing to with this. The one is external. Anything outside of you. These are the ways.
Just a little bit closer.
Right there?
Yeah.
How about that? Okay, these are, let me try it with two hands here. All right, how about that? These are three areas to attack pain in neuropathy, pain in your life. Number one is the external, anything outside of you. Number two is attack it with things that you take orally or internally. And number three, look at his brain. There's Ted's brain. Psychologically, how you think. And now I want you to remember I just said three things: internal, external, and psychological. Think of yourself that way. Well, that's what's going on with Ted. He's a little depressed. He's not doing too much. His feet hurt. Okay, he is. He's not going outside much. And so he eats a little more, and that's not unusual. It's the American way sometimes. So think of your body that way. Just take a breath. Remember, right now, I'm going to go into what are the how it is that you attack this pain in those three areas: internal, external. Well, I'll start with internal first, then external, and then psychological. Real things you can do about it. Things I've seen work. So, you ready? Sarah? Do you have any questions, Sarah?
No, your pictures actually really help me a lot, just breaking that down a little bit. So thank you.
Okay, well, can I show it again? Okay, thank you.
That and drawing as well. They're both wonderful.
If this I'm going to draw a lot of pictures.
Yeah. No, the understanding of how, like, that simplicity of the pain from neuropathy comes from the nerve damage. And it's just that simple. It's the causes and the way that damage shows up that can look really different, but the takeaway is it's just nerve damage. And so that really helped kind of break it down for me a little bit more. So I like that. So let's talk about Ted. Let's talk about what he can do about it now. Go
ahead.
So we're starting with internal.
Yep, we're going to start with those three environments. The first one is internal. Remember, when I talk about internal, and anybody talks about internal, you talk about nerves. Let's make this one statement very, very, very clear for anybody who doesn't know this. If you do the things that are correct, you can heal and regenerate your nerves. I've studied regenerative medicine. I've seen what it can do, and I tell you to understand, please, nerves can heal, number one. Number two, they can't heal overnight. And number three, it'll take you beyond 6 months to get a pretty good feel of exactly where you're going with it. So you got to give it time. Nerves heal. You can help them. Or you can stop them from ever having those issues like Ted. Poor Ted now's got it. Honestly, it's been coming on for a long time. If he'd had gotten his sugar in control 10 years before, but he wasn't thinking about that. He was thinking about golf, actually, I think. Anyway, so internal healing. Let's talk about this. I like to talk about, first of all, what I said about medications, because you take them internally. And I'm going to repeat what I said, because I know a lot of folks who are on pain meds and medicines, and they affect you. Remember, I talk about psychologically, but remember, very seldom can you take a pain medication and not feel tired, not feel sleepy, not lose some balance, not something. So the idea of staying away from them, if you've got other means, it's really good. Not saying that you have to, but combination therapy is not unusual. And so if you realize if you're taking a pain med, you're just blocking this. You're hiding and not healing. Get that? Hiding and not healing. So I like to talk about just a few things. For instance, when you take, and I talk about supplements because this is what Nerve Renew and this company develops products to help heal neuropathy and affect lifestyle. So immunity, I mean, I know exercise and I know the one product they have is called Immune Complex, really helps to boost that immunity. And here's why it's important in later life. Your immune system is fighting your whole life, but as you get older, it's a lot weaker. So thinking about immunity and stopping disease processes from attacking those myelin sheaths is important. Secondly, you got to think about blood flow. How do you get blood flow and oxygen via a supplement? It has to increase your nitric oxide. It's got to dilate the vessels. It's got to keep them from going into spasm. The more oxygen you get, the more nitric oxide you get, the better your nerves can heal. And the whole picture here is getting the stuff like oxygen and supplements to the nerve. And that all comes through the blood. So the other thing is actually healing factors. The reason that I've seen that supplements work is simply because alpha-lipoic acid, benfotiamine, methylcobalamin, these things which you're probably not going to remember but are important, have all been shown via almost every study out there to heal nerves, to decrease pain, which is what we're talking about tonight, and give you better lifestyle. We're talking about foods now, because I talked about things you're going to take orally. You're going to take supplements. You're going to take things that are going to increase your blood flow. You're going to take healing agents that are going to help heal. This is all internal. And the best thing is foods. How many times have I said eat the rainbow? Nice, bright foods. Huh?
Yeah, you say it a lot.
Foods a lot, because it's so easy but so difficult to make that change. If you can do it just in the morning to begin, just some bright vegetables and things like that, rather than bacon or fatty substances, and in the evening, instead of using butter, moving to olive oil, things like that, it's a big deal, because everything you eat hits those nerves within 20 minutes. So that's a fact. The blood flow goes everywhere, and your nerves are just wanting to get better just as much as you want them to get better. So I just mentioned external immunity, getting blood flow, getting oxygen, getting nitric oxide, eating the right foods, taking healing agents that'll heal the nerves. So I may be moving fast, but I want you to see yourself, because that's what I just told Ted. Ted, quit eating all that junk. You know what? I'm going to tell you what you're going to take every morning, and that's going to help you, and you're going to have to give it plenty of time. I'll check the oxygen flow you have and see how good you are, and usually guys like Ted are okay. And then I'll just send some fruit and vegetables to your house. No, I won't really. But so that's internal. Okay, well, let's talk about external ways to beat pain. External ways. And these are really important, because most people don't do them. Most people are so busy not doing what they should do that they don't do what they should do. Did I just say that? Yeah. That's pretty good. Okay. So the idea is that your nerves that cause pain, that are damaged, that are going to the brain, actually those nerves are right near the surface of the skin. Now, I'm talking specifically about sensitivity of pain, not other nerves internally or whatever. I'm talking about feet, hands, mostly feet, when they start hurting, which is what's happening to Ted. The problem is people don't realize just what's happening with these nerves, and they're right on the top of the skin, just barely there, and they're waiting to be affected by something. Now, remember, these nerves are initially sending the pain signals, the ones that are fairly close. And if they're not getting blood flow, they're screaming. If they're not getting oxygen, they're screaming. If you're walking on them and they're sensitive, they're going to send the wrong signals, and they're screaming. You're going to feel this pain. So the idea for me when I'm talking about this is affecting nerves directly. And believe me, light touching and doing these types of things I'm going to talk about wake those nerves up and increase the blood flow. For instance, hey, I like a direct massage to your legs and feet or whatever's bothering you, mostly legs and feet, almost every morning for 5 or 10 minutes, just moving that up. And I think we can talk about that, how to do that at one of the other talks. But basically massaging from lower to higher, massaging those areas and waking those nerves up. So massage, I love, and they do make really great compression socks, compression devices, because what that also does is push that lymph flow up and gets rid of the toxins. So think about massage. If you got up around, I'll talk about that again in a minute. Secondly, I like TENS units. I don't know if TENS units stop pain for a long time, but they stop pain for a short time. And when I say, I've seen some folks use a little TENS unit every morning, every other morning, or sometimes twice a day, not overdoing it, and they'll get hours of pain relief, or at least decreased pain. Some of them have been astonishing. Some have not been great. But in most cases, you got to know what's out there. Massaging and then TENS units, which are fairly inexpensive. I like creams. I know Nerve Renew has a neuropathic cream. I like that, and I've used it on my knee, which is numb from a surgery, and that has worked very well. But I like it when I use it to massage. Two ways I use it. I use it for massage, and I also put it under a sheath at night on my knee, just rub it in first, and then let it soak in during the night. Now, that shouldn't be done so much if you have wounds on your legs or things like that, but I think that that will help things sink in a little bit better. I like the new copper compression stockings. I think that this is a solid way to cause warmth and stimulate the nerves without you doing a lot. If you're wearing them and walking around, it will work better for you. So the copper pressure stockings, and there's a new thing out, and we're going to be talking about that pretty soon. And this, remember, we're external. We're talking about low-level light therapy, red light therapy. It's interesting, and I'll bounce off of that. Is that okay for a second there, Sarah, that I move? Okay.
Yeah,
I like the idea of the red light therapy, and here's why. It's like a laser. And what it does is, think of it, every cell, every nerve cell, not just the myelin sheath, because they're full of cells, but every cell. In that cell is a thing called a mitochondria, which is like the stove of the cell. It's what gives it its energy. When you use red light therapy and on these cells, they will fire up that little mitochondria and produce more energy. When that cell produces more energy, it produces more antioxidant type substances. It stimulates that cell, and it helps the cell to regenerate. It's very simple stimulation, but it works. So we'll talk more about red light therapy later on, because I know there's some new devices coming out. But I want you to be aware of that and the simplicity of some of the things we're talking about, directly affecting the nerves externally. Okay, is that pretty good so far, Sarah?
That's very thorough. I like that you're giving people options. You know, there's different things for them to try, because inevitably one thing is not going to work for everyone. This nerve damage is far too complex for that. So I'm glad that you're sharing multiple examples of things that people can try.
Well, and then people's lifestyles are different. They'll be able to, if they're more mobile, they can do something, and if they're less mobile, they can do something. But kind of pick and choose. I don't tell people to take all of these. Just try something simple, like the massage and the cream first, or something like that. Okay, so let's go into the last part of this, which you think is, well, I'm going to say one more thing about, do I want to talk about that? Yeah, you know what? Sarah, you know what I think is the best external, besides affecting nerves directly, externally?
What?
Absolutely yoga. Any type of yoga, stretching, any type of exercise, keep them moving. Yeah. But a lot of folks really don't understand, or really don't know, that the stretching and the effects of yoga on the muscles, the lymph flow, the increased oxygen, the increased blood flow, the stimulation of the nerves, especially if you couple it with something else, is magnificent. If those of you out there haven't tried yoga, neither has Ted. Ted, will you try a little yoga? Yeah, your wife does it and you're scared to go because everybody will make fun of you. Too bad. Let's try some light yoga and stretching and do some massage of your feet. We'll talk more about that. So Ted seemed to be a little depressed. Did you notice that, Sarah? Because you'll be my nurse then, I guess. You agree?
Absolutely. Mm-hmm.
So his feet are hurting and he's sitting around a lot. And I don't like that, because I really like to motivate people to move and do things. But I'm going to talk about something that most docs don't talk about, and most preventive docs, which is what I also have had most of my life, is a psychological aspect of getting pain relief. Yeah. So some people think that not thinking that accepting it is the way to go. The answer to that is wrong. No, you have to have a plan, because the studies have shown this. If you psychologically attack this, that you ready for this? This is like my one other big point. If you attack this psychologically, your brain will regenerate its signal processes, just like any other nerve. You can train yourself psychologically to limit focus on the pain. And also, when your brain is doing that, it's also regenerating its pathways so that you don't sense that pain that's coming up as much. So this is the psychological aspect, because I talked about external, I talked about internal, but I want to talk about that just a little bit more, because I know we can't be here all night. But that has a lot to do just with focus. And I want to tell you, well, two things that I think are the best. What do you think are the two best psychological ways to decrease pain, Sarah?
Gosh. I mean, first thing that comes to mind is like the power of positive thinking, right? It's like taking control of those thoughts. It's the first thing that comes to mind for me.
Sounds like a book I read. Let me think about it. But you're absolutely right. That is, thinking in a positive way will absolutely change the way that you attack life. And it motivates you, and the other one will also. It motivates you to wake up and say, you know what, I'm going to try something new. It doesn't have to be crazy. I'm not telling you to go build the Eiffel Tower, but if you walk a little further than the mailbox and can start some sort of a program where he's not sitting around quite as much because he's motivated to get up and move, because he's thinking positive thoughts. Positive thoughts are thoughts that says, I will, I can, I must do. Those things repeated daily truly have an effect on the brain in its regeneration of its circuits. So all of you out there right now, help me with Ken, because I'm going to make Ken say this right now. I can do this. I will do this. I'm going to do this. Nothing is going to beat me. I'm better than this. I'm not going to let neuropathy take over my life. So now we're getting into some motivation. And I'm making Ted repeat that in the room. It's just what I've always done. Ted thinks it's funny now. That's the first time I've seen him laugh all morning. So Ted and I are having a good time now because he's seeing the light. He's seeing a focus. Okay, second one, Sarah, that I think is wonderful.
What is it?
Well, music.
Okay.
Music, psychologically, music is a wonderful healing device. There is music therapy out there. A lot of people don't know that. And it's very, very effective. And it's effective because, again, it regenerates the nerve fibers in your brain. But you know what? It brings back memories. It makes you feel positive. Hearing the old songs that you used to hear when you were young, or a lot of them, the new ones, however they're doing it, making them get up and move around and dance a little bit will help heal neuropathy. I swear it will. But you got to have a plan on that. And I tell people, look, plan a music time every day, even if it's 15 or 30 minutes. Look, I'm not telling you to sit in your lounge chair and listen to music. I'm telling you to get up and move around and dance or do something and close your eyes and enjoy it. And I promise your life will be better. And with time, you're going to realize that will get more and more and more effective because you'll learn to focus longer and longer and longer and longer. And you will not be feeling a lot of that pain that you were feeling and focusing on before you started the music. So, Sarah, do you have a favorite song?
Oh gosh, I couldn't pick a favorite song. No, I have too many.
Okay. I know I thought I put you on the spot with that, but anyway, and I did. So sorry about that. So psychologically, anything in the arts and being creative is I think, important. The music, creating, doing new hobbies, but I really like the music. I really like the idea of hearing it and feeling it and not forgetting where it comes from and doing something with it, not just listening. So
Yeah.
those are the three areas. I know I talked a lot: internal, external, and psychological ways to attack pain. I didn't once tell you to take a pain medication because I really believe in natural health. I really believe that nerves will regenerate. And I really believe if you just do something without a lot of prescription medications, you realize you're not going to rely on those. You'll kind of force your motivators to take you in a different direction.
True.
I think that for what we've done tonight, I'm going to kind of stop there. There may be a couple questions or some folks have, but and then I'll do a quick summary. Are there any questions or anything that anybody wants to ask or?
I had I wanted to add one thing to your list.
Right. Go ahead.
I think it would go under the external category, but it also really plays into the psychological, and that is a community. You know, it's not being an island in your journey with this. It's really easy to just seclude yourself, and it's so hard to get out of your own head. If you have someone that can help pull you out when you have those really bad days, or when you really don't want to go on a walk, or when you really just want to veg on the couch, if you have that community, even if it's just a person, but a group of people, somebody that can be there for you and encourage you and be that voice when your voice isn't getting it done, that is huge. So I would add that to the list.
So yeah, and one of the things that I wrote earlier, can't remember. It's been a while since I wrote that, and it was involving you guys. And I call them neuropathy buddies.
Yeah.
People who not only may or may not have, but they're people who you should call and tell them about your issues, and whether it's a friend or maybe not, maybe somebody from church or another community, whatever it is, and ask them if they would call you and motivate you and make sure they call you up maybe and say, hey, listen, could you give me a call once a day and tell me to get moving? Well, yeah, I'll do that. Okay. Come over and talk. But yeah, I like the idea of neuropathy buddies. So I thought I'd throw that out because I guarantee you nobody out there has heard me say that or knew that it existed. But now you're thinking, well, I need a neuropathy buddy. But sure, that's a great point. Community is everything. You got to be part of it. And Ken, unfortunately, isn't playing much golf now. And so I'm going to get him back out to the golf course. If he's just putting, it's better than nothing.
Mm-hmm. Absolutely. Okay, so I'm just checking the time. I know we're kind of coming up onto our end here. So I know you've got a quick recap. I've seen a lot of questions coming through. I have a couple. Let's just try and tackle a couple. If you can just answer real quick for these couple. And then you guys, if we don't get to your specific question, rest assured the customer service team will be going through and making sure every single question and comment gets addressed. So don't worry. But the ones that I'm seeing right now, this one is related to something you mentioned. Bev asks, so should we stop taking pain meds while taking Nerve Renew? Can you speak to maybe how those can be part of a treatment plan together?
Well, I'll tell folks, you always have to talk to your doctor about it. Number one. Number two, do not stop your pain meds to start Nerve Renew. I think that you need, you can start you could if you wanted, but you probably shouldn't initially. My recommendation is to start the Nerve Renew and then maybe talk to your doctor about weaning. Remember, a lot of pain meds have side effects when you stop them. You're going to have some withdrawal. You don't want to have that. But on the other hand, you also want to know with time that your nerves are getting better. And I know in some places we have up to 2 weeks when people are feeling less pain in their feet. And I think that weaning down is a good answer, but you got to review it with your doc.
Yeah.
You don't have side effects, but you can take both of them together. That's absolutely fine. There's no problem with that.
Yeah, I think that's a good thing to distinguish is that though they can work together, but it's also you have to have that measure of whether it's improving or not. So that's a good thing to keep for Bev to keep in mind. And one other note, Bev, is that we want to space out when you're taking those. Some of those medications can actually negatively impact how nutrition and specifically these ingredients are absorbed into your body. So they actually can kind of go to waste if you take them together, one swallow or just, at the same time. So space those out by a good hour just to make sure that your body can really absorb them and so you're getting the full effects of both.
Perfect.
Okay.
Absolutely.
All right, one more quick question. This is from Steve. Why are my neuropathy symptoms worse in the evening?
Okay, there's a multitude of possible answers to that, but I think if you go back first of all, if you've been up and around all day long, and you've been pumping the lymph and everything from your legs, and you're moving around, you're starting to have some. When you lay down at night or you put your legs up, first of all, if you have vascular disease, which means low blood flow to your feet, whatever, and you lay down at night, there's a chance that blood flow won't be getting to your nerves as well. So that's sometimes a vascular issue. Secondly, stasis, which means things are just not moving as well. And so the nerves are not getting as much oxygen at night, not getting as much nutrition at night. And they're actually just not, remember I talked about the stimulation, the external stimulation, and not getting that. And the third thing is, I think sometimes when you go to lay down and it's getting worse at night and you're kind of trying to relax, your focus is back on the pain, especially if you've had a lot of bad nights. When you're thinking, uh-oh, here it comes, it's going to get worse. And so I hope that you can look at it in different ways to say, well, and if I were you, I would, if that was happening to Ted, who just left the office, I would say, Ted, do me a favor and bring a chart in and tell me exactly what time and what you're doing when your pain increases at night. May mean I have to check some blood flow levels in your legs and or do some other nerve conduction studies. But the answer is generally lack of activity at night. And remember, those fires may want to light up a little bit. And also sometimes they're just not an answer. Sometimes that's just neuropathy. So I'm trying to help answer that, but it's a difficult answer without, I think you have to focus on you and one or two issues about what may be causing your neuropathy. And then remember, you're going to give it time. And I'd keep a record and talk to your doc for sure.
Yeah, that's true, because there could be so many different factors that could be contributing to that.
Absolutely.
And without you being able to ask Steve more of those specific questions, that can be hard. So Steve, that may be a great question to bring directly to your doctor, because he'll know more about your particular situation. As I was scanning through some more of the comments here, I think something that's really important to understand with neuropathy and nerve damage as a whole is that it is so complex. It varies the way that it presents itself, the way that it happens, the way it responds to treatment varies so much from person to person. It is such a case-by-case thing, and I think you can attest this, Don, where there's still so much learning that's happening surrounding nerve damage and neuropathy.
Right.
Still figuring it out, like what you just said. It's just neuropathy. We don't fully understand the full scope of what this is and how it's just very complex. So I think if I can leave you guys with anything tonight, it's to stay empowered in your own education. Just because one thing worked or didn't work for someone else doesn't mean that could apply to you. If it maybe something worked for somebody else, but it doesn't work for you. And there's just keep pursuing your own journey with it. I think it's really easy to get caught up in people saying, don't try that treatment, or don't try, yoga doesn't do anything. Well, maybe it didn't for them, but you have to understand how complex this is. Your condition can look nothing like someone else's. So just stay empowered in your own journey with this. Keep educating yourself, keep talking to your doctor, keep growing your community, because there are things that can help you, and you just maybe haven't found what it is yet. So just stay true to that and keep trying, keep pushing, and keep working to improve your life. That was on my mind. It just reading through some of the things that just stay true to yourself, guys, and keep going. So, and we're here to help in any way that we can, with providing this kind of knowledge. Don, we just always thank you for bringing your decades of experience to this. I mean, how valuable is that? You've treated so many patients over the years, and we get direct access to you and all of that knowledge. It's just wonderful. So, I will let you do a quick wrap up because we are out of our time for this evening. Unfortunately, it always goes by so fast. So, what are some things that we can leave people as takeaways tonight before we sign off?
I think in terms of just blocks: external, internal, okay, and psychological. If you could pick one area in each one of those and write it down tonight, write it down where you can see it, and then write out something that you're going to do with it. Internal, external, okay, and psychological. Write something out next to it. It doesn't matter whether it's right or wrong or goofy or not. Just the very fact that you do that tonight, well, at least leave that thought there, and hopefully it'll bother you in the morning if you don't do something. So, you know what? If I was going to do something tomorrow morning, I would get up, and if you do some massage, do something tonight or tomorrow that you've not done previously. And that's my challenge to you guys. Listen, nothing's perfect, but don't get in the habit of getting too busy, and I hate to say it this way, the habit of quitting. Don't quit this. You can do anything if you just stay at it. Don't make it complicated. All I did was say internal, external, psychological, write something next to it. It's your challenge tonight. Put it on a yellow pad or get one of these. This is a picture of Ted, and write something. There's a lot to life, and the whole reason we're here is to motivate you guys to take that next step and fight this thing, because neuropathy is a real beast, but we can tame it, I promise. So that's it for me. Good night.
Well, Don, thank you. We really appreciate you as always. Anything else before we sign off? We're all good? Okay, wonderful. Well, you guys, thank you so much for joining us this evening. If you were able to join us live, thank you. We love seeing that. If you're catching the replay, we hope this is really valuable for you. Please stay in touch, stay engaged on our pages, keep asking questions, and we'll just keep trying to bring you some valuable resources every single month. So we'll see you next month. Good night, Don. Have a great night. We'll talk to you later.
Good night.
Bye.